I decided to seek help for my schizophrenia after a suicide attempt that I had in school.
People are actually feel embarrassed because of the conditions that they carry, and so they're dealing with shame and guilt.
I have bipolar disorder, and I've had it. Well, I had what they called a nervous breakdown when I was a teenager. Nobody on the planet was coming out saying that they had a mental illness.
The prejudice and discrimination that happens in the workplace or among individuals is one that really surfaces on a regular basis.
I used to be ashamed to say I was mentally ill because people would talk about you.
After I lost my brother a year ago, I think it profoundly changed me to really want to remove the barriers of stigma, because that's really, the stigma and the shame are really what led to him not being able to ask for help. And before we can change anything, we have to actually start talking about it.
Managing and preventing mental illness. It's a challenge in the best of times. Sadly, these aren't the best of times. As America battles coronavirus, mental illness is the hidden pandemic. But great challenges reveal greatness. This moment is our chance to build bridges of understanding and stretch our arms around the vulnerable among us. At this extraordinary time in history, mental health is more important than ever.
We have a philosophy here called Before Stage 4, where we believe you should treat mental illness at stage 1 like you would treat cancer, because the prognosis is better. For example, the only way to get into the hospital is to go to the emergency room and you have to be a threat to yourself or someone else. That's stage 4.
At Mental Health America of Eastern Missouri, we know the power of early intervention. Each year, our helpline connects with hundreds of callers. We link them with treatment, support groups, and legal resources. We provide life-saving referrals and information. And we offer online screening tools that quickly determine symptoms of a mental health condition.
Let's say you think, gosh, I feel so anxious. Is there an issue here? You can take the anxiety test. It'll score you low, moderate to severe. Then you can print that result out, take it to your healthcare provider, and they're 40% more likely to actually give you a treatment plan than if you just went in talking about those same symptoms.
Our Bridges program fosters healing through education and peer support for those diagnosed with a serious mental illness. Bridges combines a multi-week education course with ongoing peer-run support groups. Participants gain a critical understanding of their illness and a renewed sense of self and purpose.
I started with the Bridges program, which is part of Mental Health America. I started going to the support groups, and after a few weeks, it was like, I think I want to do this. This would be fun. And I've been running the Bridges program since, and Bridges stands for Building Recovery of Individual Dreams and Goals Through Education and Support.
When you're facing mental illness, managing money can be challenging. Our Representative Payee program meets this challenge head-on. Representative payees are financial guardians. They ensure that food, housing, and utility payments are made on time. And in the process, they promote independence. As we celebrate this program's 20th year, we honor more than 2,500 clients who found stability since the program's inception.
I met someone that seen something in me that I really didn't see in myself. And that person is Darren Scotland. He's my financial advisor.
That's really an important program here. We started it many years ago, and it allows them to go and succeed in whatever they're trying to do.
Which one would you choose to be? Someone don't have to worry about a light bill, gas bill, phone bill, water bill, trash bill. That's some of the stigma that's removed from society.
Education is a catalyst for change. Our professional development opportunities strengthen the skills of those working with people who have mental health challenges. Wellness seminars teach valuable techniques to handle life's challenges.
We're one of the oldest advocacy organizations in the country. We're fighting for people who don't have a voice, who can't stand up for themselves.
Our mission includes advocacy. For us, it means fighting for equal rights. In every arena, we are battling for parity, the recognition that mental health disorders should be given the same level of resources as physical illnesses.
Our impact on people is not going to be a building, but you'll see it in the community as people interact better, as they feel better. Or you'll hear this story where Perhaps we were able to work with a policeman. They were able to go in and defuse something because they got mental health training. If you want people to be creative and ask the question, what can we do to improve situations? We're the kind of folks who do that.
Like no generation before, today's college students are struggling with stress, anxiety, and depression. Through our Collegiate Mental Health Innovation Council, we're tackling the crisis head-on. The council empowers students to advocate for the elimination of stigma, one of the biggest barriers to treatment and recovery. In return, these students empower us by providing insights that shape and guide our efforts going forward.
I focused heavily on academics. I was a Virginia Aerospace Science and Technology Scholar through NASA.
In high school, I was lucky enough to have co-discovered a pulsar through the Pulsar Search Collaboratory. A pulsar is a super dense neutron star that emits dipole electromagnetic radiation.
So when my symptoms started to interfere with my school, that's when I started losing hope, and I was afraid to reach out.
First, we want them to be able to identify what's going on, so we want to educate them so that students are not getting to a point where they're not sure what to do.
I would have much rather have learned about it in an outreach event at the university. It might have even made me less afraid or intimidated to seek that proper medical treatment.
It's really important for the students to be able to tell their stories, and they can relate better when they hear the storytelling from someone that looks just like them.
When it comes to supporting education and awareness on college campuses, it's crucial because this is a very pivotal time in a young person's life.
We wanted to create this council in order to help college students, number one, look at what their campus is capable of doing and maybe what it's not, and where would they like to see help? How would they like to be involved in making change?
Here's an organization that's been around for quite a while. We've been impacting the community in numerous ways over those 75 years. But right now we're all at a turning point of how can we make more impact into the community. How do we impact the first responder community? How do we impact the veterans community? How do we impact the everyday citizen to make their lives better?
If we want to broaden our approach to mental health, we need to hear perspectives from across the whole community, rural as well as urban. We recently reached out to Jason Meadows, one of our community partners.
I'd say whether you live in the city or even out here in the country, right now we're facing a lot of the same challenges. COVID, polarization, job security. So it's no surprise that mental health problems are on the rise. I don't think we talk about mental health enough. In fact, I know we don't. One way to support MHA is to let people in the community know that it's okay to talk about it. It's probably never been more important to talk about mental health than it is right now.
We are a voice for the voiceless, hope for the hopeless. We are the light in the window and last line of defense. As we battle the greatest mental health challenge of our lifetimes, our impact has never been stronger. We are fighting for more than 1 million Eastern Missourians who experience a mental health or substance use disorder each year. The numbers are growing by the day, and the stakes have never been higher.
I would just ask everybody who is seeing this video today, to think about your why. So for me, it's my brother Paul.
My why is really my passion that this is just wrong, that everybody should be able to get mental health.
It's allowed me to get closer to my church.
Why I do this is so that people can become aware.
My why are all the students out there that are afraid to open up about psychosis.
My why is my grandchildren.
Who is your why?
My daughter.
If you're here with us tonight, you've already made an investment with MHA. If you feel that's something that you could make a deeper investment in, we would be incredibly grateful for that.